The guide tube tap-in is one of the most universally utilized techniques in all of acupuncture. This is true for TCM and traditional Japanese medicine. Now, saying that, how TCM practitioners and TJM practitioners tap in their needle into their guide tube is slightly different. In today's video, we're going to really dive in and pick apart the traditional Japanese medicine guide tube tap-in and give you a few hints on how you can improve your current tap-in technique. My hope is that with this slight improvement to your guide tube tap-in technique, it will improve your overall treatment without having to change too much of your protocol or theory. Now, I do always put a disclaimer in these videos that without mentorship, it is really difficult to learn and master any traditional Japanese technique or theory. So I really highly suggest that you do find a mentor that can help you really bridge the gap between your current TCM practice and traditional Japanese medicine. Now, if Shinkyu University sounds like a good fit for you and your practice, I highly suggest setting up a chat. Let's talk through your goals and also the barriers in preventing you to reach your goals to truly bridge that gap between traditional Japanese medicine and traditional Chinese medicine. You can find a link for that discussion in the description box below. All right, so let's get straight into it. To participate in this video with me, you're going to want to have something to work on, a guide tube, and a needle. Doesn't have to be anything special. I'm using my little silver guide tube because it's reusable and I like the weight of it, but you can use anything that you have. The little plastic ones are just fine. So I'm using my little needle pillow here. This is what we made in acupuncture school at Toyo Shinkyu Senmongakko in order to really perfect our needling practice. You do not have to have a needle pillow, a piece of fruit, pineapple, apple, orange, anything will do the trick. I do not recommend utilizing a really soft bed or a mattress or a pillow just because it's just not enough resistance to really give you a true feeling of how it would feel on a human body. So in a previous video, I talked about Oshide. We're definitely going to be utilizing your Oshide in this video. If you're unsure about Oshide, you can go ahead and rewatch that video. I'll try to link it somewhere up here and also in the description box below. But you're going to want to utilize your Oshide. Now, the reason for this is that with a TCM insertion, usually you're just holding on to your needle or to your shaft or your guide tube, I should say, with your dominant hand, and then you usually take off your index finger and smack the needle in. Now, a lot of people do a lot of things in order to stop insertion pain with this. They tap alongside of it, they'll tap over here, they smack it in really fast. They do a lot of different things, and what unfortunately ends up happening is you bypass a lot of the tissue structure and a lot of the key that might be at the surface level in order to get that needle in quickly without pain, but also it's a very abrupt needling process, and so for a lot of people that can cause pain, especially for your really sensitive clients. So what you're going to do instead is you're going to utilize your Oshide. We're going to set up our guide tube so that way our entire dominant hand is free. Now, if you're one of those people that are like, I can use my left and right hand and I oscillate, don't do that. Please decide what your dominant hand is going to be for needling and just keep it that. So my non-dominant is my Oshide, my dominant here is going to be my right hand because that's my dominant hand. Now, ideally, what you're going to do is tap in your needle in 3 taps. And we want it to sound a bit like a heartbeat. So we don't just want to smack in our needle. Oftentimes, I see TCM practitioners smacking in their needle, and everything is really emphasized with this downward flow. But really, a guide tube tap-in, the emphasis is on the upward flow, is the pickup of your hand rather than the downward push onto the shaft. So tap just to the, that first tap is just to get the needle into the first layer of skin. So if I did this right, my needle will fall out a little bit like that because, let's see if I can do it, show you. It should just be that very first layer of skin, and so the needle falls down sideways. So, and then the second tap is going to be to have it insert halfway, third tap all the way to the top of the guide tube. Then you can reload. Now notice that both of my hands are doing a lot of different jobs here. My left hand, my Oshide, for me is working in tandem with my right hand. And if I wanted to do other points, it's automatically finding that other point for me. Automatically. Now, one of the things that I see people often make mistakes with the guide tube tap-in when they're first learning this is one, their Oshide is really wonky. It allows the shaft to move too much. Again, that too much downward force. And then last, of course, is that they don't have very good rhythm. And you might wonder, like, why is rhythm important here? And that is because with rhythm, it allows the body to really sync up to what you're doing and allow it to feel really gentle to the body. All right, so before I go any further, I would love to know if you utilized your Oshide in the practice. Let me know in the comments below. So there are a lot of nuanced things that we could go into with the guide tube tap-in and of course with your Oshide and so many other aspects of traditional Japanese medicine. But for the sake of a short YouTube video, we're going to skip that. I would love to see you practicing this in your clinic. Feel free to tell me your experiences in the comments. I would love to hear what you were struggling with and what you are curious about. Go ahead and let me know down there. Now, as I mentioned before, mentorship is really key in learning traditional Japanese medicine techniques. Please do reach out to me if you feel Shinkyu University and mentoring with me and my teachers would be a good fit for you in your practice. You can find a link for that in the description box below. Thank you so much for watching this video. Please don't forget to like, subscribe, and hit that little bell to be notified of future videos coming out all about traditional Japanese medicine to truly bridge the gap between your TCM practice and your TJM practice. If you would like to learn more about your needling practice, you want to check out this video right over here.